Hi, my name's Joan. I'm with the ACCN program and I'm an instructor. We're just going to be going through the setup for the pulmonary artery catheter today. First, I'm just going to show you the equipment that you're going to need, and then we'll go through the actual setup. One thing I would like to mention is that between facilities there may be slightly different equipment and slightly different procedures, so just be sure you're aware or familiar with those policies and procedures and the equipment that you're going to be using in your institution. So for the pulmonary artery catheter, you're going to need the pressure tubing. In this case, we've got pressure tubing where we have both the two transducers for both our pulmonary artery pressure as well as our central venous pressure. In other institutions, they may be single. You might have to get one or more different tubings for that. The other piece that you're going to need is for your cardiac output. Okay. We'll also need and again, this might change between institutions, but a 500 ml bag of normal saline, as well as a 250 ml bag of D5W. I'm just going to set up a clean area. This is more sort of personal preference. And we're not indicating that this is a sterile area, just a clean area. So I'm going to start with my this is the dual pressure tubing that I have here. You can tell by the coloring that the blue here and blue here is for your central venous pressure, and the yellow is for your PA catheter pressure. Okay. Now there's a couple manipulations that we're going to want to do before we actually attach this to the PA catheter. And again, this might be slightly different depending on your institution, but generally what we want to do is to change the position of the tubing with respect to the central venous pressure. So right now you can see we've got the three-way stopcock, and this pressure transducer is moving straight through to the end. What we want to do is just change that. So we're going to take this piece off, take off the, oops, sorry, keeping that sterile, of course. Taking off the cap and attaching it at a 90-degree angle. Okay. The reason you're doing this is that when you attach the cardiac output, you're going to want a straight line, for the cardiac output to go into the PA catheter. Okay. So that's the first piece that you're going to do, and I'm just going to actually reattach this to keep that sterile. Then the other piece that you also may want to do is to change the cap on here so that when you're actually withdrawing from it to get your mixed venous gas, that you have a proper attachment on there. Okay, so we're just going to pop this on here. That's so when you're drawing a gas for your mixed venous. Another thing that you may see, and again it depends on the placement of the catheter, whether it's in the subclavian IJ or in the femoral area, is that you may want to decrease the amount of tubing that you have. So for example, we're going to say that this is maybe in the IJ, internal jugular. So I'm just going to take this piece off, and I would throw away that piece. I'm going to move this over to this side here. And then I'm going to reattach it to my transducer. Okay. So you can see now that you have a nice short area, so that if the catheter that you were using was in here, that you wouldn't have this long piece of tubing. And keeping in mind that the longer the tubing, the more potential interference with respect to the reading. Okay. Once you've arranged this as you would like with the right length and the CVP at the right angle, then we're going to actually attach it to our saline solution. Some institutions will use a heparin solution, so just make sure you know which you do in your particular area. Okay, so I'm going to spike the bag. Getting a little bit of fluid into the chamber. And then with pressure transducers, we have to remember that we need to first fill that transducer. with fluid, and then we can move the fluid through the other areas of the catheter. Now I like to just flush prior to putting the pressure bag on. That's personal preference. I find that there's maybe a little bit less likelihood of getting bubbles in the transducer, but that's entirely up to you how you want to do that. So I'm just turning the transducer sort of upside down. So this is the piece that's going to attach to the patient. I'm going to turn the transducer so that it's off to where it would be attached to the patient, but it is open to the transducer. Okay, and then in order to get this moving appropriately, we need to pull that pigtail. So I'm just going to make sure I haven't got anything clamped here. I'm going to press my pigtail, or pull my pigtail, sorry, and you're going to see the fluid move through there, and that means that you've flushed it through. Taking a look to make sure in the transducer that you don't see any bubbles, and if you do, you just give that a tap. Okay. Once you've flushed this through, we're going to turn that off. And we're just going to make sure that we put one of the blue completely blocked off caps on there. These smaller caps that usually come with the tubing actually have a hole in them. So we just want to make sure that we get rid of that and add the one that's going to keep that end sterile. Okay. So now we're going to move the fluid through to the end. So right now with this stopcock, I've got it off to this piece here, and we're just going to flush through. Okay. And then we also want to flush the cap as well. Let's give that a little bit loose so that that fluid can go through in there. Good. And then we'll tighten that back up. Okay. And then for now, because we want to maintain the sterility here, we can just pop the end on there until we're ready to attach that to the patient. Okay. The same process needs to be done for the CVP portion. In this case, I've left the tubing on, this extra piece of tubing. Normally, if you shortened one, you would short the other, but just so we can show you how it looks like when there's the longer piece of tubing. So again, I'm going to go back to the transducer, and I'm just going to flush that through, make sure there's no bubbles in there. Okay. Once I'm completed that and it looks good, I'm going to actually take off this white piece and put on the sterile, completely blocked off cap. Okay. Okay, so now I'm going to flush the remainder of the tubing. Okay, so I'm just going to loosen this cap here that we put to keep that end sterile. I've got it off to where it's going to attach to the patient, and I'm just going to pull that piggy tail. You can see that fluid going through. I'll just take I'll take that off completely, I think. That's sterile. There we go. Nice, and you just want to make sure all the air is out of there. Okay, place my cap back on again, and now I can do the end piece. And in some cases, you may want to just even take this piece off too. Again, it just sort of depends on where this is positioned, but we'll flush that through as well. Okay, so now this tubing is completely flushed through. The other piece that I had talked about before, the other piece of equipment that we had, was our cardiac output. So this is the cardiac output. Actually, I'm just going to even move this over to the side so you can see this a little bit better by itself. This is our cardiac output syringe, and I'm just going to be attaching this to the D5W. Okay, so I'm going to pop this up here. Okay, so we've got that spike there, so now we're going to just flush this tubing through, making sure that this clamp is open. And to do that, I'm just going to use the actual cardiac output syringe. So this piece here is actually a one-way valve. So that's going to prevent the fluid, when I push through, from going up. Instead, it's going to come out. So first, we're just going to pull that up. So we're getting some fluid into that syringe. And just like with any other syringe, you're going to make sure your air bubbles are out, so that you're pushing that air out first. Okay, looks good. And I'm just going to actually get rid of all that fluid right now. And normally you're potentially take a couple times for you to fill the syringe and push out before the fluid has come all the way down. But just making sure at the end of it that you've got that fluid all out of there. Okay, so now that we've flushed the tubing with the cardiac output, we're going to actually attach it now. So you'll remember that we've put the CVP piece at that, or the transducer from the CVP at the 90-degree angle, and that was so that we could attach our cardiac output here. Okay, so we're just going to pop that in there. Okay, so now we've got the cardiac output in a straight line so that when you're shooting your cardiac outputs, it doesn't have to go around a 90-degree bend. And you can see here our fluid coming out. Okay, and there we have it. So now you have the pulmonary artery catheter tubing, the pressure tubing, completely primed and ready to go and attached to your pulmonary artery catheter for insertion.